Good morning and hi everyone. We are from Group D and we will be presenting our E-Consultation Patient Education Management Plan with clinical scenario of anxiety and claustrophobic. In this video, the patient has the history of Hesperonychus syndrome and referred for RT for definite treatment for pituitary adenoma. He was unable to tolerate the immobilizing mask even with 5 mg of lorazepam. First of all, the guardian has to go to the website for e-consultations registration. So what they should do? First, choose their preference of consultation platform, which will be either private message or video conference. Second, it will be choosing the time and date for their e-consultation. The consultation will be approved by the staff in charge and appointment reminders will be sent 1 day prior to the consultation date. At the end of the consultation, a satisfaction survey will be given to ensure the patient's engagement.
Hi and good morning. I'm Jeremy and guardian for Mr. A.
Hello, Mr. Jeremy. Just to confirm, is the one beside you is Mr. A?
Yes, he is.
Great. Hello, Mr. A. By the way, I am Tara, the radiation therapist whom in charge for this consultation session. May I know your queries and what can I help with?
My son will be undergo radiotherapy treatment soon, but he has anxiety and claustrophobic attack due to his history of having Asperger's syndrome. I'm scared he cannot cope during the treatment. How to overcome this?
Oh, it's alright, sir. This problem also happened to other normal patients. First, I need to ask you something about him. What are the things that make him feel happy and upset? Does he able to lie still? If so, for how long he can?
He do not like many people surrounding him and only comfortable with people that he always meet. He able to lie still for about 15 minutes only.
Alright. So, let me explain briefly on the procedure first so that you can get a clear picture on how the situation will be and during the treatment day. First, I will show you the visual storyboard from the simulation to treatment. Every cancer patient will have this simulation session first before a radiotherapy is given. Basically, the patient will be scanned using the donut light machine and the CT images will be used to plan the treatment. Okay, so before the real simulation, we will give a mock session to familiarize Mr. A with the situation first. With that, Mr. A will be more comfortable during the real CT simulation. Besides, we will provide wide selection of music or ambient sounds for Mr. A to choose from and listen to during the treatment, which can actually promote his relaxation. So we will also put aromatic smell in the room, and he can also bring anything to reduce the anxiety, such as a squishy toy.
Alright, can I know when is the mock session usually be given?
Usually we will give it 2 days before the real simulation day. On the simulation day, he will receive a sedation before the scan start, and after giving the sedation, the anesthesia doctor will always monitor him, so you don't have to be worried. Continue with the CT simulation. He will have to lie supine on couch. Under the body, we will put a long sponge and knee support under the knee. This device will provide comfort to him during the procedure. An open radiation mask will be applied onto his head to prevent the movement. And this mask will not cover the face of Mr. A, so it will reduce the anxiety, but it is a little bit warm.
How long this can usually take?
It takes about 30 minutes.
When will be the treatment day?
Normally, it needs about 2 weeks time for our physicists to finish up the best treatment plan for Mr. A. So after the CT simulation are done, you can go back home first and wait for our call. We will inform you the date of the first treatment and any preparation needed. During the waiting time, before the treatment start, he can try to wear Ultraman mask or Spiderman mask to reduce his claustrophobic problem. And he can try to lie supine and wear it and don't move for at least 30 minutes as a practice before the real procedure, so that he will be more familiar with the radiation mask during the treatment. Now we will show you how radiotherapy works. Actually, the treatment procedure is very similar to CT simulation. The mask made during simulation will be used during the treatment, and you will be left alone during the treatment, which is about 30 to 40 minutes. So during the procedure, please do not move during the whole treatment. So the first day of the treatment, it may take longer because we have to do bone matching verification to ensure that it is well matched with the simulation plan. This machine will rotate around you to deliver the radiation at different areas. So please don't worry, we also provide you the link of the video to show how the machine actually works.
Okay, but I'm afraid being alone.
You don't have to be afraid, Mr. A, because there are several CCTV in this room, so you can always monitor and we can see you from the outside. There's also a microphone in this room, so you can communicate with us whenever you feel afraid or uncomfortable. So don't worry, Mr. A, you are not alone.
Okay, I don't know whether I can give cooperation during the procedure or not.
We will give you medication to ensure the treatment runs smoothly.
I heard radiotherapy will cause side effect. It is true?
There is a link for your reference later on. Radiotherapy can kill tumor cell, however, it may cause the side effects too. Those side effects may include fatigue, skin redness, osteitis, nausea, and also alopecia.
So how to overcome these side effects?
Usually, we will monitor your son's condition daily throughout the treatment time. You can always consult with doctor to get medication to reduce the side effect from the treatment. We also prepared a template in the link below for you to know the management during and after their treatment.
After the treatment, I will bring him home, right? So what should I do to ensure my son is in good condition?
For patient care after treatment, patient is advised to get more rest and drink a lot of clean water. And he should not apply any ointment, soap, lotion at the treatment area and do not scratch at the treatment area. If possible, please do not expose the treated area directly to sun. For bath, usually patient should rinse the treatment area with water only and pat softly after having the bath on the treatment area. So, for patient monitoring during the treatment day, the monitor that shows patient oxygen level and heart rate can be seen also through the CCTV. Besides, the anesthetist team will be there throughout the whole treatment if sedation is required in order to ensure the whole treatment will run smoothly. Mr. Jeremy, do you have any other things that you're concerned about?
But can my son proceed with the treatment without sedation? Is this possible?
Actually, it will depend on how Mr. A's can cooperate during the mock station. Usually, we will pre-screen our patient for mask anxiety by familiarizing them with the mask prior the first setting. We also provide education on the relaxation strategies such as controlled breathing, mindfulness, and also meditation. In addition, we will try to provide holistic alternatives that promotes relaxation without side effects or restriction to activities such as aromatherapy. For your information, in some patients with anxiety, inhalation aromatherapy can be a great adjunct to control the breathing as well as can help patients to be more relaxed. If all this is still not working, we will proceed with sedation.
That is quite convincing and I hope it will be beneficial for my son.
We hope so too. Apart from this, do you have other queries regarding this matter?
For now, we are well understood. Thank you so much for your explanation.
Okay, you're most welcome. If you have another query, you can always ask us through the private messaging in the same website.
Alright, no problem. Thank you so much.